hoping in the next few minutes, I can convince people here that there is a path on how to create a stress-free virtual clinic experience for residents, for yourself, for your staff, and for the patients. I know there may be people who may not believe this, but I can reassure you that we had this experience that really went very well. And just to give you a background of where I come from and why I'm so confident is I'm a psychiatrist who primarily and only works in emergency settings. So I work in PsychEmerge services in St. Joseph Hospital. And the team, our team provides assessment for patients who present with acute psychiatric crisis. So we assess and manage patients who are presenting with acute suicide ideation, acute homicidal ideation, acute mania, and acute psychosis. So it's not it's not a surprise that when I ask my colleagues to describe 3 words for the environment I work in, the 3 top words that they would always describe PsychEmerge is volatile, high risk, unpredictable. And when I ask them to describe the patients we serve, I think there are 2 big words which come up: high risk, complex needs. And even given with that, we were able to create a clinic that I'm really proud of, that went off really well in the past 2 months, and which was literally stress-free for everyone. We conducted around 220 clinic encounters until today in the past 2 months, out of which 99% were stress-free. 1% was a bit of stressful, mostly because of me, because I hadn't charged my phone. So how do we create this? I wanted to share some of the insight of how we managed to do this clinic. And by the way, this photo, which I picked up, was to see what my future dream of virtual clinic could be. I'm really hoping that in the next few months, when the travel ban is lifted, we can take our virtual clinic to an oceanfront resort, and the supervisor sitting in an oceanfront while we supervise the patient, the residents. Can I have the next slide, please? So what I learned in the past 2 months is that there are 3 big pillars for a virtual clinic to succeed. The first pillar is a team, the people. The second pillar is the equipment, the phones, the computers. And third is the paperwork, the documentation. Now, what I learned is that the pillars have to be strong and the foundation has to be tight. And what do I mean by team? And that's what we're going to focus today in the talk. The team is who you're going to work with. In this case, you are primarily going to focus on resident, but again, the teams can be different in sizes and different in location. So some of the clinics may just be between supervisors and residents, but in my team, we were multidisciplinary. So we were very, very fortunate to have 2 residents per 2 weeks. And then we had 1 experienced social worker and 1 experienced nurse. So we were able to assign the teams to look after the patients. So how this clinic came about was that our patients, when they come to PES, generally they are assessed, managed, and pre-COVID time, they would get follow-up through family doctors or through specialists. Unfortunately, when the COVID hit, the family physicians were not ready in the early stages to run the virtual clinic, and our outpatients were not ready. And the patients also lack their general social support, such as family, friends, or work and peers. So they were left with very little resources. So we had to come up with a clinic that was fast, rapid, was efficient, and was safe. During this period as well, we inherited a cohort of 5 junior residents who were unable to attend to the learning needs they needed because they were posted in inpatient services. And the beds were reduced because of the COVID surge. As well, the number of patients getting admitted in the hospital had been reduced. And some of the supervisors were out of action because of quarantine or for social isolation. So we had a match of high need patients with junior residents, and we had to develop this clinic that could run very, very fast. And what I learned from this is that pillar became really strong because you need to know your team, need to have certain values and goals. And what do you need to know about your team? You need to know what they're good at. So get to know your resident. Can we move for the next slide, please? So there are 3 principles we apply on figuring out how to make your pillar work, the people pillar work, is know, prepare, and evaluate. So know your team. So know who's in your team, what their strengths are, what their expertise are. So in this case, in the resident, find out what level of training they are in. What have they seen? How many virtual clinics have they seen? What their learning goals are, and figure out what their worst anxiety is about this clinic. Find out what their learning style is. As well, when you get to know them, also get to let them know you. So tell them what your teaching style is, to let them know what your supervision style is and what you expect from them. So for example, out of my 6 residents we trained in the past 2 months, there were a couple of residents who had never done virtual clinic. They were quite anxious and they wanted to know that I was available before every clinic and after every clinic. And there were other residents who had done some virtual clinic and they were quite happy for me to check in the beginning of the day and end of the day. So knowing that is really important to plan on how to help them and supervise them in the clinic. So it moves on to preparation. The knowledge is going to help you prepare. And how do we prepare them? So preparation, it means training them. So have a clear process. So write down a process on how your clinic is going to run, how the patients are going to be assigned, how they can contact you, where the referrals are going to come from, and how do they contact the referring sources if they need to. And that's really important to have this conversation 2 days prior to them starting on the clinic. Because we were having 2 residents move every 2 weeks, I made a point to call them maybe like before 2 days. I would call them, introduce myself, introduce the team, get to know them, and sometimes run a mock clinic to make sure their equipments are running well. And thirdly is the evaluation. It's a dynamic process. So you are trying to figure out why that clinic went well and why that clinic may not have run well. So, and then feed it back to your knowledge, know about this patient. So if a clinic really went well and the patient was satisfied, the outcome was good, look back and see, why did that go well? Is it because the match of the patient was good? Were you specific in what you wanted to do with the learning goal with the patient? If things did not go well, what was that about? Was it because the assignment was not correct for the resident? Or was the patient too high needs for the supervision? And then reset on what you're assigning them for the next clinic. And we also found out the 3 principles can be applied to the other 2 pillars as well, which is paperwork and equipment. I'm not going to go very much in detail with it because Heron and Amy have done a great job explaining to us what the paperwork was and the equipment. Now, one thing I also is important in this piece is to understand in the paperwork is to know about billing techniques. So know the billing criteria for telephone, but also empower your residents, even the junior residents, on the criteria so the documentation matches with the billing criteria. Can we move for the next slide? So the documentation, consent, and I think Amy had gone in detail on how to get consent, how to document it. But I think taking one step further, make sure you get the consent for the family members to be there as well. Templates or shortcuts. You could develop templates in your EMR for the clinic so they can run faster. Then attestation and evaluation. So think about how you're going to assign them an EMR. How are you going to attest and how are you going to co-sign and agree with your resident on how that's going to happen? And as I spoke about, like the billing is an important piece that I think the residents have a great opportunity to learn and train under you as well. So know the criteria, tell them what the requirements is for the billing so they can document accordingly. And the last one was the medical legal issues associated with virtual clinic. And I think this was very important for us to know and prepare our residents for, especially for psychiatry and family medicine, is if you see someone on Zoom or have a conversation on the phone and you're worried about for their acute psychiatric crisis, how do you bring them into the hospital? Are you able to do Form 1? And what we realized, but we talked to the capacity consent board, and what we know is we are allowed to do Form 1s even on the phone examination. And that was, I think, reassuring for a lot of residents when they were doing this clinic, knowing that they can bring back the patient to the hospital. So be aware of the legal issues associated with this clinic, and have a technique. And I'm sure different clinics like Endo is going to have a different medical legal issue. So is the medical clinics. So just be aware of what medical legal issues can come up and train your residents accordingly. Can I have the next slide, please? So how do we prepare the residents? Map out the clinical process. So walk your resident through who's in the clinic, how is it going to run, and what their roles and responsibilities are. Talk to your residents about supervision arrangement. Talk to them what they would like and write it down. Give them in writing, email them what a plan of supervision is going to look like. Again, provide training. It could be a mock training or a video clip that can be sent to them. We can develop video training programs using webinars, obviously. Then educate on boundary issues. Now, this I'll go a little bit in detail in the next slide, but virtual clinic has inherent issues and blind spots that if you're not aware can come and bite you. And for a stress-free clinic, I think we need to be open to those blind spots, to have a plan, contingency plan, and to address them beforehand, it becomes a bigger problem. Develop a feedback loop. Like, how are you going to provide feedback to your residents? Consider sending patients notes or charts or information 24 hours before the clinic, so the resident can read up on the patient's note, do a pre-charting on the patient, and discuss with you a strategy on what the learning goals can be, or what the clinical task is ahead of time. Consider debrief. So after they see the patients, they can call in and talk to you about what went well or what did not go well. If you're joining them in the clinic, you can take a moment to debrief if there was a difficult situation and train them to get back on road again. Next step. So this is just an example of how we ran the clinical process. And I wanted to share with you, we had a pretty large team, as I explained. So we divided the team in a non-clinician, non-clinical, non-physician team, which was a clinician team, included social worker and a physician, and the resident team that included the physician team that included resident and the supervisor. We had a clear plan where when the patient was referred to us, the first contact was made by the team A, who would make a contact with the patient. They review the current needs, assess the mental state and risk, and they discuss with the resident. And this team and roles were written up very clearly and emailed to the residents before they started the virtual care, and then was included in the orientation training for them. That really helped smoothen to solidify and clarify what the roles for each member in that team was. Can we have the next slide? Again, this is with the clinical process, which again explains this, just the last slide in a little bit more detail, is like, how do we get the referral? So our patients were patients who were discharged from PsychEmerge, and the referrals were placed on the whiteboard. So it was a very simple technique. We did not go for electronic data, but maybe some clinics would use that to send off an automatic patient list to the residents. Then the resident and the clinician name were placed on the star next to the patient name. The initials were placed. And this was actually shown through the FaceTime. We did a FaceTime to show this whole whiteboard and how the process was done. And then the next plan is just to talk to the team B, and the treatment plan and dispositions were agreed between the nursing team and the social worker team and the resident. And if they had a problem, they would get the supervisor right there if they didn't agree on the same treatment plan. Can we have the next slide? And this is the tip sheet we sent to our residents beforehand, is to be aware of boundary issues. So what are boundary issues? So because it's in an informal setting, and they're not in an office, there are concerns that we may share more personal information with them than not needed. Like, you may be giving out some personal cues if there are shopping bags around, or there are pictures of the family, photos, things you would normally not share if they were coming into a physical space. So being aware of those issues are very important, and having a discussion with the resident is very important, and having a strategy on how to address it. So it's not very uncommon for me when I do a video call for family members of patients to butt in and ask me where I come from. So to have a script on how to address that is extremely important. Avoid providing personal telephone number. It's kind of given that most people would know, but starting as residents, as junior residents, we were surprised that some of the residents did not know that they're not allowed to give personal telephone numbers. So we advised them to provide private calling numbers. Again, do not provide personal information, and really important for work-life balance. What we found was our residents were too dedicated. Sometimes they were calling the patients later in the day because they couldn't get hold of them, or the clinic appointment did not go very well. So they would call after 5 or the weekend. So we have to be very aware that if the working hours in physical space was from 8 to 5, that's exactly what we're going to do with a virtual clinic, and to really balance the work needs with your life commitments. Next slide, please. And lastly, just really, I thought a simple acronym for our stress-free clinic was ABCDEF. A is accessible. Make sure you are accessible to your residents when they're there. Like for my example, the 1% where I did get stressed was when my phone wasn't charged. So make sure your phones are charged so the residents can contact you. Give them a couple of backup numbers. So it could be a home number or your office numbers to make sure you're there when they need you. Have a background, so know your resident, know what their needs are, and their learning styles. So know them really, really well so you can support them and you can help them. Communication. Be very clear on what, in your communication style. Send them, use emails. Be very clear with how you communicate. The last one is diary, is to have a schedule that you can share with your resident. Tell your resident where you are. If you're in a different clinic, or if you're running an emergency department, or if you're going to be off for some time, make sure they're aware that you're committed to other programs. And have a delegate who can take the role of you if you're not available. And lastly, enthusiasm, right? Because doing a virtual clinic sometimes can be quite frustrating when the system doesn't work. So if internet is not working or the phone isn't working, make sure you're still enthusiastic and you're still motivating your team. And we found that wasn't much of a trouble most days, but there were days that can get boring. So as a supervisor, it's your job to keep them motivated, keep them enthusiastic. And lastly, being flexible. So sometimes things may not go according to the plan. So be very flexible. You may start the clinic on an OTN, but your internet might freeze. So make sure you have the phone number for the patient to call them on a phone. Finish it off as a phone visit. And as Amy said, sometimes bring in the patient here. So that's probably a very quick summary of how we ran the clinic and how we really enjoyed running this clinic. Thank you.